Welcome. My name is Robert Tasker, and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Welcome to April 2024. Thank you to all our authors and reviewers. I've got three great editor's choices for you. First is about PARDS and whether or not there's a distinct entity called immunocompromised PARDS. This is a paper by Gertz et al. Looking at the PARDI dataset from 2016 to 2017, 105 patients in the cohort, and the authors have examined platelet use, diuretic use, and NIV failure. This information feeds into the PALIC-2 guidance. My second editor's choice is about ethics consultations in ECMO patients, a single-center study 2012 to 2021 by Siegel et al. 27 of 605 ECMO patients had a consult, and the authors look at the themes in the consults. The third article is early arrest hemodynamics and CPR quality in patients undergoing eCPR, and this is by Yates et al. And this is an examination of the ICU-RESUScitation dataset, 97 patients, 2016 to 2021, with a focus on arterial waveform analysis. All three of my editor's choices have editorial commentary to go with them. In the PCCM Educational Connections, we have two special articles. The first is by the Pediatric Data Science and Analytics subgroup of Polisi called End-Tidal, and this is an article by Hennigan et al. They first do a scoping review of data science papers in pediatric critical care literature, and then this subgroup presents a position paper on how best to present your research when submitting it for publication. So a great article. And the other special article is a professional piece, and this is about organization of our research, and this is from a group called SEPTA, and this is SEPTA 4, and this is a paper by Jackson et al. This group focuses on sedation and other similar medications used in pediatric critical care and pediatric anesthesia and adult critical care. There are 25 consensus statements that should help us to improve our methodology for randomized controlled trials. Do have a look at it. And lastly, we've got a return to the PCCM narrative, and this article or this narrative is called Superhero. This is an interesting piece for us because it's been written by a third-year medical student from their time of doing an attachment on the pediatric critical care unit. So well worth a read and well worth seeing that perspective. So thank you very much for all of your time, for listening to this and watching it, and I will see you next month.